Emily Budapest, and I'm going to teach you about preventing pressure ulcers. Thank you for coming out today. Okay, click. Did you get it? Alright, so what exactly is a pressure injury? They're often called pressure ulcers. Decubitus ulcers are bed sores. It's an injury to the skin and underlying tissue that results from prolonged pressure and or friction on the skin. Pressure against the skin reduces the blood flow to the skin, which cuts off oxygen to that area. This reduced blood flow causes redness to skin, and if left unattended, can cause skin to open and form a wound. These wounds can often be deep and difficult to heal. Now on our unit right now we have 2 patients that have pressure injuries. That number needs to be 0, so this is exactly why I'm about to teach this. So some area concerns are basically bony promises. We've got the heels, we got the back of the head, the shoulder, elbows, and the big one is going to be your tailbone, the sacrum. So there's going to be different stages of these injuries. We got stage 1, stage 2, stage 3, stage 4, and then the unstageables. Okay, so stage 1 basically kind of just looks like a reddened area. It is often blanchable, which means that it can lighten when it's touched, or non-blanchable, which means it doesn't lighten when it gets touched. And when it doesn't lighten when it gets touched, it means that it's progressing worse and worse. The site may often be tender, painful, soft, and warm, or even cooler than the surrounding areas. Next. Okay, now stage 2, now you can see that the skin is damaged. There's an open wound. It's going to be slightly shallow and kind of like meaty looking, where it's pink, red, and glossy. It looks kind of like a busted blister or a shallow crater. Next. Stage 3. Okay, now you're going to see some meat. You're going to see some fat that's exposed. It's very crater-like. Some areas are going to be a little bit yellow, and the damage can be hidden. Sometimes the damage can be hidden behind the yellow tissue, which is called tunneling. Now stage 4 is very, very deep. Sometimes it gets to the bones and the tendons. You'll see the tunneling like right there. It's starting to tunnel underneath the skin. And slough, which is that yellow blackish, forms, and then eschar is kind of like a scab that forms around it. Now the unstageable is basically full thickness tissue loss. The base is usually hidden under slough or eschar, and you can't really see what lies beneath. It kind of looks just like this, where it looks like a scab, but underneath it could be something that's very large and very tunneled. The colors often range from tan, yellow, gray, green, brown, and black. Alright, now who's in trouble? Whoever comes to the hospital is always in trouble. It could be young, old, but the people that are more liable to get them are basically people who are poor in health, that have chronic conditions like diabetes and vascular diseases, individuals who are polypharmacy, which means that they take 8 or more medications at a time, people who are paralyzed, that cannot move, or who are in a coma, post-surgery patients, elderly and children, the immobile, people that have lost a lot of weight very quickly, people who have skin conditions, and people who have lost their sensory perceptions. Also people who have poor nutrition, who have urinary and fecal incontinence, and excess moisture or dryness. Okay, the complications that arise from pressure ulcers are cellulitis, bone and joint infections. The big one is sepsis, and sometimes cancer. So what can we do? The best way to avoid having a pressure ulcer is to prevent one. We use things like the Braden scale. So using the Braden scale, we can kind of grade who is more susceptible to getting a pressure ulcer and who isn't, and we take that score and we use our interventions and apply them to that particular patient. What else we can do is turn and reposition every 2 hours. Use pillows under each bony promises. That way it's protecting that area, under the back, the knees, the feet, and ankles. Transfer from one place to another, chair to bed, and vice versa, using supportive devices like weight distribution air mattresses, waffle mattresses, wedges, and cushions. Definitely keeping the skin clean and dry, using ointments and lotions. What we need to do is to make sure we assess the skin each shift. What looks good yesterday may not look good today, so we want to make sure that the skin is being looked at every day. That way, if something does arise, like a little redness patch, we can take care of it then. That way it doesn't become a bigger problem, which leads to the tunneling and the eschar and all that. We want the person who is maybe has incontinence, we want to manage that and take care of them the best that we can and more often. Making sure that people are on a healthy diet and are maintaining that diet, they're getting nutrition, even if they aren't able to eat a full meal, making sure they have Ensures available, anything that they can get protein-wise. And definitely the best way is to hydrate. So I brought a few things that we can do to help prevent. When a person is incontinent, we want to use creams and ointments. So this ointment right here is basically if they're more urinary incontinent, we just put it on their perianal area and make sure that they are dry and to cover this up, and that basically avoids them from getting any kind of irritated skin. This is Caliseptine ointment, which is a thicker ointment. It is to help with fecal incontinence. You put it on the bum and any other genital areas that can be exposed to fecal matter. Let's see. To help protect the bony promises, we have the leave-ins. So we can put these on any area. It can be open as well, but these really add some cushion on. So maybe we can put this size onto the elbows or the heels. We've got a bigger one that can go on like shoulder blades. We have ones that are even shaped to put on your sacrum to help cushion the back. And for the bigger people, we got the bigger ones, the bigger butts. Also, for when patients want to sit in chairs, we have these waffle pads to put underneath them, and it distributes the pressure points and the weight. And then for people who aren't able to turn themselves, we have the big long waffle mattress that you can pump up and put on a regular mattress, and this will also help protect the pressure points. For people that aren't able to move their legs, we have Prevlon boots. So you put the heel of the patient right here, and this gray thing wraps around it and provides some cushion on the heels and the outside of the ankles. And then for the more heavier patients, we have a tap system. So this helps turn and move patients that aren't, it would be hard for one person to do on their own, usually over 500 pounds or this goes underneath them, and then there's wedges that can go along their back and underneath their bottom so that it provides some sort of weight assistance as well. And that is my presentation. Anybody have any questions? No questions?
If you're at home, if you
Where
have
can you find these products?
Where can you find these products? CVS.
Retail stores.
retail stores do carry the waffle mattresses and definitely the creams. You can go on Amazon as well. They have, most likely they'll have these waffle pads. Any kind of pharmaceutical company, nursing home care companies also.
If you have a elderly family member at home,
Yes.
what's the best protocol for them since they're not able to get up and walk around as much? Is it just getting them from one position to another occasionally?
You just want to make sure that they are repositioned. It doesn't have to be like getting from a chair to a bed. Now, if they're sitting in the chair, you just kind of want to make sure that they're repositioning themselves every 2 hours so that there's some sort of weight distribution between them. That way they're not just laying on one side for 2 hours and that pressure holds and then it'll form that bed sore.
Okay.
Now, if you go, like, say they're laying like this, and then 2 hours you lay them like that, and you just flip back and forth.
Okay.
That way there's an even distribution of weight.
So if I would happen to see a redness on some part of my loved one's body, what's the first thing I need to do? Do I need to call a doctor? Do I need to, contact a healthcare provider to get ideas of how to start?
Yeah, I would definitely talk to your doctor about that, make them aware, because we definitely want to stop it where it starts.
Great, thank you.
Because this will lead to an infection if it doesn't get taken care of. The doctor will definitely provide you tips and what you can do in order to prevent it from opening.
Okay.
And maybe give you like a referral to a wound nurse that can come in and take a look at it, or to a place that maybe will have resources for you to look at.
Okay, thank you.
All right, thank you. Anything else? Very good. All right, well, that was my presentation. Thank you.
Thank you.